Imagine just for a second how incredibly vulnerable a newborn animal is. Just arrived, everything's new, instincts are just starting to kick in, but there's this tiny detail, something we often overlook that can become a huge problem almost immediately, the umbilical cord. It's
Yeah.
not just like tied off and you're dead. Our deep dive into expert sources shows just how crucial its care is for a newborn's survival. It's pretty eye-opening. Okay, let's unpack this. Today we're diving deep into a condition called Omphalophlebitis. Most people just call it Naval Ill. It's a really significant threat, especially for the young ones, in two really interesting animal families. Camelidae, so camels, llamas, alpacas, and Cervidae, which is, all our deer species. Our mission here is to give you the essential info, the stuff that really matters, so you understand what naval ill is, why it's important, how to spot it, and crucially, how to prevent it. We've sifted through a lot of expert material for this.
What's fascinating here is that umbilical cord. It's literally a lifeline before birth, right?
Hmm.
Providing everything. But the moment the animal is born, it flips. It becomes this potential entry point for, well, serious trouble. It just highlights how absolutely critical those first few hours and days are, how that little stump is managed. It can make all the difference.
Okay, so let's get straight to it. What exactly is Omphalophlebitis? Basically, it's an inflammation and infection of the umbilical vein. Think of it as an infection right there at the navel, the umbilical stump. It's surprisingly common in newborns, and the research really stresses how fast a seemingly small local infection can blow up into a whole body systemic illness if you don't catch it quickly. It's like having a tiny unlocked door that needs to be shut and sealed fast. Otherwise, unwelcome guest bacteria can just walk right in.
Yeah. That door analogy is spot on because understanding the pathway, well, it really shows you how serious this can get. When bacteria get in through that stump, they don't always just stay put. They can travel up the umbilical vessels, the vein, the arteries, sometimes even the urachus, which connects to the bladder before birth. These structures get infected. It might start locally, maybe form an abscess, which is bad enough, but the real danger is spread through the bloodstream. That leads to septicemia, blood poisoning, which is, immediately life-threatening. And think about this. The umbilical vein goes straight to the liver. So it's a direct highway for bacteria to cause nasty liver abscesses. Or the infection can spread from the blood to the joints, causing septic arthritis. People sometimes call it joint ill, though that's not quite technically right. We're even talking potential spread to the brain, causing meningitis or infection of the abdominal lining, peritonitis. It shows how a small start can become fatal.
Wow, that's quite sobering. How such a small entry point can lead to such widespread disaster. So, who are these usual suspects, the bacteria causing all this trouble? And what sets the stage for them? Well, the research points mainly to bacterial infections. Things like E. coli, different kinds of Staphylococcus staph, and Streptococcus species. Trupperella pyogenes also comes up a lot, and it can get even more specific. For Cryas, the baby camelids, you might also see things like Enterococcus, Listeria, Citrobacter. And for fawns, you add Clostridium, Salmonella, Pseudomonas to the list. It's quite a lineup. They're often just waiting for an opportunity.
Exactly. Opportunistic is the key word. These bacteria are often just around in the environment, but it's not just the presence of bacteria. It's the predisposing factors, the conditions that basically roll out the red carpet for infection. Yeah.
Right. The sources really emphasize these. First off, and it makes sense, is a contaminated environment. A newborn landing in a dirty pasture or a stall that hasn't been cleaned out properly. That's just asking for trouble, direct exposure. Then there's inadequate umbilical hygiene, just simply not cleaning or disinfecting the navel properly right after birth. Another huge one they highlight is failure of passive transfer, or FPT. This happens when the newborn doesn't get enough good quality colostrum that first milk soon enough. Colostrum is like their first critical dose of immunity from the mother. Without it, their defenses are way down. Think of a fawn maybe struggling to nurse right away. That's a classic FP2 risk. And finally, anything that leads to compromised immune function. Maybe not enough colostrum, maybe a stressful birth, poor nutrition in the mother. It all makes the newborn more vulnerable.
Precisely. And what's important here, I think, is that these factors, they're largely controllable. If we connect this to the bigger picture, this points straight to the power of prevention. We're not dealing with some mysterious, unavoidable plague here. It's about basic, solid management. Hygiene, nutrition, good early care. Apply those diligently, and you can dramatically change the outcome. It's empowering, really.
That makes sense. So knowing the risks helps us prevent it. But if it does happen, how do you spot it? You mentioned local versus systemic signs. For someone watching these newborns closely, what are the telltale signs? Let's break it down. First, the local signs. What you see right at the navel area, Look for swelling. Maybe it's painful if you gently touch it. It might feel warm, or look wet all the time like it won't dry, or obviously any pus-like discharge. You might even feel that the umbilical cord structure itself feels enlarged or hard, or find a distinct abscess. For fawns, specifically, a swollen, hard, or just persistently wet navel is a big red flag. Okay, but then things get much more serious if you see systemic signs. That means the infection isn't just local anymore, it's affecting the whole body. This is where you need to act fast. We're talking about a fever, the animal looking depressed or listless, anorexia, meaning no appetite at all, just profound lethargy. Maybe they're not growing well, or they lose that instinct to suckle. They just won't nurse. You could also see signs of sepsis itself, like a really rapid heart rate that's tachycardia, or rapid breathing, tachypnea, maybe even diarrhea. And for fawns, keep an eye out for weight loss, and especially lameness or obviously swollen joints. That points strongly towards septic arthritis setting in.
Yes, and the key thing is speed. Those local signs, they definitely warrant attention. Get the vet involved. But the moment you see any of those systemic signs, the fever, the lethargy, the not nursing, that's a full-blown emergency, the infection is spreading, and it can overwhelm the animal very, very quickly, leading to fatal sepsis. So immediate veterinary help isn't just a good idea at that point. It's absolutely critical. The window for successful treatment shrinks fast once it goes systemic.
Okay, so spotting the signs is step one. But what's the actual game plan for vets when they suspect naval ill? How do they diagnose it for sure, and what does treatment look like?
The sources outline a pretty clear approach. Diagnosis usually starts with a good physical exam, looking closely, feeling the umbilical area for those signs we just talked about: swelling, pain, discharge, abscesses. But to really know what's going on inside, especially deeper structures, ultrasound is incredibly valuable.
It really is. It lets you see if the infection has gone up the umbilical vein or arteries, or if there are abscesses forming internally, maybe even in the liver. It gives you the full picture of the extent. Right. And then there's blood work. A complete blood count, a CBC, and checking fibrinogen levels. These help show how much inflammation or infection is going on systemically. It gauges the body's response. And then, for targeted treatment, culture and sensitivity testing is key. Vets will try to get a sample, maybe aspirate fluid from the umbilicus or an abscess, send it to the lab. The lab identifies the specific bacteria, and this is crucial tests which antibiotics actually work against that particular bug. So you're not just guessing with treatment.
Exactly. Targeted therapy.
Yeah.
Which leads us to treatment itself. It's usually a multi-pronged attack. Antibiotics are the cornerstone. Often they'll start with a broad-spectrum antibiotic, something like ceftiofur, ampicillin, maybe enrofloxacin. For CREAS, procaine penicillin G is a common choice initially for naval infections. These cover a wide range of likely bacteria while waiting for those culture results. Then, if the results show something specific or resistant, they can switch to a more targeted antibiotic.
Makes sense. And what about the inflammation and pain?
Right, you need to manage that too. So anti-inflammatory drugs, NSAIDs, like flunixin, meglumin, are usually given. They help reduce the swelling, the pain, bring down the fever, makes the animal feel better, and helps recovery.
What if the drugs aren't enough, or there are complications, like those abscesses you mentioned?
Good question. Sometimes medical management alone isn't sufficient, or you get these stubborn walled-off abscesses. In those cases, surgical intervention might be needed. That could mean surgically draining the abscesses, or even removing the infected umbilical remnants, the leftover bits of the cord structures inside.
Okay, and I assume there's more to it than just drugs and surgery.
Absolutely. Supportive care is vital, especially for these little ones. That means things like intravenous fluids if they're dehydrated, nutritional support if they're not nursing well, keeping them warm, managing any other secondary problems that top up. It's about supporting the whole animal through the fight.
It sounds like a lot hinges on acting fast.
It really does. The sources are unanimous on this. With early diagnosis and prompt, aggressive, appropriate treatment, the prognosis for naval ill is actually generally pretty good. But if diagnosis is delayed, if the infection becomes systemic, if you get complications like widespread sepsis or those internal abscesses, the prognosis shifts dramatically. It becomes guarded or even poor. It really is a race against time.
Yeah, a very clear message. Which makes this next part maybe the most important.
Yeah.
The power of prevention. So what does this all mean for you? This is where knowledge really becomes power, because prevention is by far the best strategy. Way more effective than trying to treat it after the fact. We can boil it down to 3 main pillars, based on everything we've read. Pillar 1, diligent naval disinfection. This is non-negotiable, and it has to happen right away after birth. The recommended solutions are usually 2% anatidine or 0.5% chlorhexidine. They work well. But for fawns, the specific recommendation is often stronger. A tincture of at least 7% atidine needs to be potent. And how you apply it matters. You need to completely dip the stump or thoroughly spray it. Just a quick dab won't cut it. And sometimes, especially if the risk is high, you might need to repeat the application. It's a simple step, but incredibly effective.
Huge barrier, yes. Such a small action, such a big impact.
Exactly. Okay, pillar 2, a clean birthing environment. This one's obvious, maybe, but critical. You have to minimize the bacteria the newborn is exposed to right at birth. So clean, dry bedding. If it's indoors, fresh straw, clean the stall thoroughly between births. If outdoors, try to use clean pasture areas, minimize exposure to mud and manure. It just reduces the sheer number of bacteria waiting to invade.
Reduces the challenge level significantly.
Right. And pillar 3, excellent colostrum management. We keep coming back to this because it's fundamental. Getting enough high-quality colostrum into that newborn within the first few hours is absolutely paramount. That's where they get their initial antibodies, their passive immunity. It's their first line of defense internally. For fawns, making sure they latch on and nurse effectively quickly after birth is just vital before their gut stops absorbing those antibodies well.
Liquid gold, truly.
Yeah, and beyond those 3 pillars, it's just about ongoing monitoring, keeping a close eye on those newborns in the first few days, watching for any subtle early signs of trouble at the navel. Catching it early makes all the difference.
Absolutely. Those 3 pillars, navel dip, clean environment, colostrum, they aren't just suggestions. They are the foundation of good neonatal care for these animals. If we connect this to the bigger picture, implementing these simple, proactive steps is how you prevent a huge amount of suffering.
Yeah.
It cuts down mortality, saves money, whether you're raising camels, alpacas, or managing deer. It's about giving them that strong, protected start right from day one, the best possible chance.
What an incredible deep dive. We started thinking about this tiny newborn, it's so vulnerable, and we've really unpacked the risks hidden in something as small as the navel. We looked at the bacteria, the risk factors, how to spot the signs, local and systemic. We walked through diagnosis and treatment. But yeah, most importantly, we've seen how powerful prevention is. Hygiene, colostrum, environment. It's amazing how these basic things can have such a huge impact.
It really makes you pause, doesn't it? This raises an important question. How does really understanding the vulnerability of that umbilical cord, seeing how simple early care can prevent disaster, how does that shape how we think about a strong start for any life, really, in any situation? That feels like a universal lesson, about foundational health, about protection. It reminds us that sometimes the simplest, most consistent actions have the biggest, most lasting effects. Maybe it pushes us to look for those small, critical points of intervention elsewhere, too.